LCH tech it was saying that apart from
Like this, like this.
side. Ha. Yeah, exactly.
Okay. Okay.
Uh,
So yes.
like this.
So okay, good. So this is what happened now. Many conditions, what happens is, you're going to see people coming to you into my clinic, when if you ask them, like, you mentioned, they don't put their hand at the back and sleep. They don't use computer, they don't use typing. They're just normal housewives, just doing the like normal household works, and still they get what is called as a carpal tunnel syndrome, and they get operated for it. Isn't that very common nowadays?
True, doctor. Very true.
Yeah. So
And they
uh,
get it repeated even after the operation.
yes, exactly, and that's how this, you start believing more and more in myofascial meridians, because the problem is here, but the root of the issue starts here, right from the pectoralis major. It might be here, right? And when you understand the myofascial connection, that's how you understand it could be leading from the neck, because sometimes it starts from here itself. You have the scalenes that is connected, and then there is a fascia that continues. And because of the tightness here, right, the force of it, you're actually feeling the pain somewhere here. And when you do symptomatic treatments, CTS, they do an operation to relieve the compression, and you can see that people come back to you for pain. It's the same thing with golfer's elbow or medial epicondylitis. Yes, Agnikarma is effective, but Agnikarma here for a problem that lies here, is just symptomatic. It is not going to the root of the problem, right? Just keep it in mind, that that's one condition when you talk about the superficial front arm line. Let's talk about another line. There is the deep front arm line, right? You have the shorter inside biceps brachii muscle to its insertion in the radius, along the periosteum of the radius, across the scaphoid to the thenar eminence of the thumb. There, brilliant. Now you can tell me what this condition could be. I won't take that much time because that's going to like 5 seconds. We already talked about it just now.
DQT, sir.
DQT, that's correct, doctor. So DQT, it's only surgical, but again, if you take the history of majority of these patients who come with DQT, it will be, either with, they might be excessive pitta prakriti, they might be having sweating issues, excessive sweating, improper bath timing, improper oil application, all that. And because of this, they get what is called trigger points, right from the pectoralis minor to the biceps, and then they get the strain here. Very common these days. Now, I'm not saying that all CTS is due to trigger points. I'm not saying all DQT is because of trigger points. What I'm trying to say is have this perspective as well, because most of the cases that we see, is CTS. The initial stages, most of it is because of this, trigger points that we see in our clinics, because we are seeing common people on a daily basis, so have a picture of it as well, so it can be, it can help, in your practice. That's the whole idea. Next is the superficial back arm line, right? You have the fibers of the upper trapezius converging into the spine of the scapula, continues with the deltoid muscle. You have the lower trapezius fibers continue with the posterior deltoid, right? And the head of the deltoid converges to the deltoid tubercle of the humerus. Lateral intramuscular septum to the lateral epicondyle of the humerus. into the common extensor origin, follows the wrist and hand extensor muscle under the dorsolaterals and the carpals and the phalanges, right? There you go. I think, was it Dr. Komal who talked about the patient who was a chef?
Yes, sir.
Uh, so these are all the muscles that you probably have to look for, right? The extensor group. And here is another very important structure, the lateral epicondylitis that we see in our clinic. Most of the cases, yes, even I do Agni Karma, especially when there is so much of pain, but my first option is not Agni Karma here. I'll be trying to find trigger points in the trapezius, the deltoid, the rhomboids, and trying to release this area first, right? Do a spine correction, like a chiropractic correction of this, do stretches for this, and then automatically just doing some Abhyanga itself, you can see that this pain will go off. Next is your deep back arm line. Rhomboids continues with the infraspinatus, right? Very, very important, right? This is what most of the times when condition like neuritis, people come to you like they have they can't keep their hands down, or when in certain position when they are stretching the upper back, but they're feeling this numbness in the hand, especially in these three fingers. Very, very common condition, they say. So please keep in mind, check for trigger points for rhomboids and all this, right? Next, spiral oblique chain. It's not easy to study everything, all of a sudden, because the myofascial meridian itself is a very, very vast topic. But I just want you to get introduced to it, right? It begins with the external oblique, right? It's like this: external oblique, internal oblique, the IT band, then you have the tibialis anterior, and here what it happens, it goes underneath your foot arches, and then again continues with the peroneus longus and brevis, right? That's how. And okay, so the serratus anterior, ipsilateral rhomboids, contractus, pinus capitis, right? This is more easier. Okay, so so the oblique chain actually begins with your IT band, moves to the anterior aspect of the knee, then goes underneath to the peroneal band. See, just look for the continuation here. Biceps femoris into the thoracolumbar fascia. You have the extensor group, the erector spinae group, right? And from here again, it cannot go straight underneath to the spinous capitis, right? So it actually begins from the. I just missed the beginning part. One second. I'm sorry about this. So it starts with your, the splenius capitis, continues with the rhomboids. It crosses over to the external oblique, and it goes from the external oblique, internal oblique, right? The IT band, continuing to the anterior of the foot to the in the back. Here is peroneus, Here is your biceps femoris, and then your the erector spinae group, and then underneath the into the continuing along the erector spinae group. So that's how the oblique chain is, right? There are a lot of videos available. Check for anatomy trains. Just keep revising it, and then you will get the answers to many of these conditions that we see in our clinics today. Next is the lateral chain. It includes the IT band, the tensor fasciae latae, the gluteus, the external and internal oblique, ipsirector adductors. I'm just going to go fast because we won't have time to discuss everything. The posterior sagittal chain is something that is very, very important, in clinical practice, and it's also one of my favorites. So, if you look at the posterior sagittal chain, this is the longest in the body. It begins actually from just above the eyebrow, goes over your scalp, and right at the back, right? Thoracolumbar fascia, your hamstring, your gastrocnemius, your calf muscles, and underneath to your plantar area. So this will give you an understanding how improper bath can affect, and how sometimes giving proper oil can treat a condition like plantar fasciitis, etc. And when you understand treating plantar fasciitis, initially, yes, I used to do a lot of Agni Karma. I must not tell that, it is not effective, because in my initial days of practice, Agni Karma gave me a lot of patience, and, but nowadays I rarely do Agni Karma for plantar fasciitis, because I'll be focusing more on, since those persons, most probably they will be doing a standing job, right? And you could see that they have tight hamstrings and they have tight gastrocnemius. And when you release these two areas, you can see that, and do some stretches, just do a local massage, you can see you're getting good results in plantar fascia. And also, this is very important in Ayurvedic point of view, because here is how you can say that, how applying, just like Mula Thaira, just oil on the head, applying improper oil can give you pain along the back, your knee, etc. Because people don't feel that's very scientific, applying oil, but it is a very effective practice. The posterior oblique link, latissimus dorsi, contralateral gluteus maximus, thoracolumbar fascia, right? Very important. We are talking about the shoulder joint. Now, sometimes what happens is, even when you have a trigger point in your right hip band or a trigger point in your gluteus muscles, right? Because there is a connection between the opposite sides of the, through via the thoracolumbar fascia to the main muscle for the extension, or to lift the shoulder, the abduction of this is that the latissimus dorsi should relax. And because of the tension, or because of there is a contraction, and because of there's a trigger point here, what happens is sometimes this may not be able to stretch, and as a result, people will be stuck here as well, because of a problem not in the shoulder, not in the upper back, but because of a problem in the gluteal area. So just be aware of these structures. It's all available online. Make use of it. Again, anterior sagittal chain. The most common thing that we see in practice is, pain in the ankle, edema in the ankle, right? Post-fracture, because this is always affected. Knee pain, you can see how the imbalance in the ankle joint will lead to a knee pain, etc. So, and the deep anterior chain. Will these planes give abdominal pain? It will give pain, but it will not be, what do you say? It will give muscular pain. Yes, in the area of abdomen, sometimes what happens, we always get confused if it is related to an if it is an abdominal cramp, if it is something related to the stomach or the internal organ itself, or is it something related to just the muscle thing. So we can see that a lot of people, who do continuous sitting, there is so much stagnation in these muscles, right? And you will get such pain. The deep anterior chain includes, I don't want to go in detail about all that because this is the most important chain when it comes to sports. You talk about the core muscle, the iliopsoas, the abductor. They always work on strengthening this area. They always work on stretching this area because all the force actually comes from this, right? So in the sports world, this is where they give more focus on the deep anterior chain. Okay, so that was just an intro of the myofascial meridians, and I would just like to talk about few signs and symptoms that could also be because of trigger points. Blurred vision, visual disturbance. Now, you see this condition, again, wrong oil, wrong time baths, they get headache, they expose themselves to sunlight, they get headache, and they come and they say blurred vision. They go to an eye specialist, they say the vision is normal, and then they worry something is in the brain, right? So what are the muscles responsible for that? You have the splenius capitis, eye muscles, you have the sternocleidomastoid, upper trapezius, orbicularis oculi, masseter. So all these are important, all responsible for blurred vision, right? Cardiac arrhythmia, pectoralis major between fifth and sixth rib, midday between nipple and sternum right side. So the trigger points in the pectoralis major muscle sometimes give you arrhythmia as well, right? Seasickness, car sickness, sternocleidomastoid, vomiting, nausea, etc. It could be because of this. Difficulty in climbing stairs, erector spinae, quadratus lumborum, tibialis anterior, soleus long toe flexors, right? People will come to us with different conditions, explain different conditions. They say that, when they were sitting or lying down, they don't have a back pain, but while they're getting up, they have a back pain. When they're walking, they don't have a pain, but when they're climbing stairs, they have pain. So, hearing the history, we can understand, we should need to analyze what is the probable movement or which is the movement that is causing pain. And then we have to draw our attention to the muscle that is involved there. And then once you understand what is the muscle there, then we have to palpate and find and check for trigger points. And if you release it, most probably you'll be able to help the patients, right? Disturbed weight perception of objects in hands, like the sternocleidomastoid, people, they come to us, they're not able to lift even 1 kg of, from the shock, they're having this silent pain, eye inability, eye redness, irritation, all related to the different eye muscles or the different muscles that is there. You can see nasal and sinus congestion, sternocleidomastoid, lateral pterygoid. You talk about, when we talk about clogged ears, right? Some people come to you, right? They just have closed ears, and sometimes it opens, sometimes it closes. They have no idea. And in the modern medicine, it's always some drops. Even Ayurvedic doctors, we do all drops. But when you check for the sternocleidomastoid, and if you feel there is a trigger point, if you release it, almost immediately the patient will say that my ear just opened, right? And that is the instances that I really was surprised, the effect of a trigger point therapy and how much we are missing if we do not know about trigger points, right? Shortness of breath. You talk about when people are breathing, they feel there is a shortness of breath, right? It is because of, the intercostal muscle that is there. You have the levator scapula, you have the scalenes, because I hope you remember the scalenes originates from the transverse forces of your cervical vertebrae. It inserts into the rib, the first and second rib. And in inspiration, what happens, it needs to pull up. But when you inhale, because of the trigger point here, there is pain, and suddenly you just can't breathe, right? Thoracic outlet syndrome, there's a lot of condition, radial entrapment, upper respiratory dysfunction. So all this, when very very in detail, these are very closely related to most of the affection that is happening in your systemic conditions as well. Another structure that we all need, dermatomes. I'm just going to quickly run through it, because you need to understand how that nerve is connected and how it is affected to one dermatome, and how that, the nerve that passes through a particular muscle, if there is a congestion, if there is a stiffness in that muscle, and if it's affecting the nerve, even that dermatome could be affected, right? And what happens is, when the muscles are affected, when the nerves are affected, it helps in it, not helps, but it leads to dysfunction of these nerves. And the very important structure, or the theory that we all learned, is the sympathetic and the parasympathetic nervous system. How this ganglion is it's responsible for the normal functioning of all these organs, right? So the trigger points that is formed anywhere, that is controlling the function of these nerves, also affects the function of that organ. That's why when you're sitting continuously, you get indigestion, you get bloating, if your posture is not proper, if you are always slouched like this, and what happens is there are breathing issues, and a lot of conditions, like if you're sitting continuously, there's so much pressure in your lower abdomen, urinary infections, urine related issues, prostate issues, all that, right? So once we understand trigger point therapy, then we should understand how the entire body is affected. We talked about the myofascial meridians, and now let's talk about the bones, because there is an interesting concept, what is called as the tensegrity. Tensegrity is something that, the bones are on top of each other, but it is pulled towards all the sides with the muscles, right? So when the muscles are in dysfunction, if there is a trigger point in any of the muscles, what happens is it also affects the pulling capacity of these muscles. And what happens, it leads to a slight misalignment in the bones. And that's exactly why sometimes many of the conditions that we see today are relating to the root, like knee pain. It mostly is related to the soft tissue rather than the bone itself. It could be due to the calf muscles, it could be due to the hamstring muscles, it could be due to the quadriceps muscles, it could be due to the extensor digitorum, like the shin muscles right in front of the shin area. When you're talking about the back, you're talking about the spasm in the muscles, in the lower back muscles. Excuse me. And when there is an imbalance in these muscles, what happens automatically? The vertebral alignment is also affected, and mostly what happens is it gives rise to what is called as the IVDP conditions. And IVDP conditions, we know it is effective, but sometimes we are not very sure on how it is effective. But once we understand the principle of the tensegrity, how these muscles are connected to each other, and why it is important for these to release the tension in the muscles, to do proper stretching, so that you're going to put the position back into normal. Because surgery for IVDP is a strict no. It is very unscientific. It is inhuman. We should never ever do it. Once we understand the basic anatomy, and with the help of muscles, yes, the treatment remains the same. You do Abhyanga, you do Potli, you do Tailadara, you do Vasti. The treatment aspect remains the same, but you're just adding a new picture of analyzing the exact condition. So you know where to apply more pressure, where to release it, where to do more stretching. When you do that, you'll be able to educate the patients also on how we should do proper stretches, right? And I just want to show you that this is an X-ray, and this is how we actually see it. And what we are looking at, like the osteophyte formation. You're looking at the curvature. You're looking at how probably there is an IVDP in the L4, L5, L5S1, etc. Right? And this is how we are more focused on. Oh, there is an IVDP, so just cut the IVDP and your problem is issued. But this is how the vertebral column is made of. There are so many tendons, there are so many ligaments. So, and when the muscles are connected, right, and when there is a pulling force in one muscle, when there is stiffness in one muscle, the idea should be release it and to relax it to get it into the proper anatomy or the proper alignments, and that is how we should treat it, right? So these are just the connections between the the vertebral nerves, the cervical nerve, the thoracic nerves, etc., with the different physical problems, right? So the C1 is associated with headaches, migraines, high blood pressure. C2 sinus problems, eye deafness, constant cold, loss of hearing. This is all available online. I'll also share it with you. You can just go through it. How each. This is basically the expansion of the parasympathetic and sympathetic system. How each nerve is responsible for a function, right? And when you're talking about, for example, let's talk about T3 here. Or let's say T1. Okay, let's talk about T1. So this one, it says the symptoms, shoulder pain, neck cramp, lower arm and hand pain, like inflammation, furry feelings in the fingers, exactly like this, right? If there is so the dysfunction of the T1 nerve, it could be right on your spinal cord, it could be along its root. That is why, and because it travels through these muscles, through the fascia, the function is affected, but the problem is not on the spinal cord itself. It is along the path, right? So we should all keep this aspect as well in mind. And there's also an interesting study about how these nervous system, it affects the emotional aspect of it, right? You have the C1, these are very, very interesting things, like how a problem in each of these nerves also affects your mood, how it affects your emotions, etc. Okay, so when we do, so once we understand, we do a soft tissue mobilization, then the next important thing is we do joint mobilization. Why? Because of the dysfunction in the muscles, right? There is a 99% chance of a misalignment in the bone as well. So it is always important to get the bone back into its proper thing. It is best to do some sort of mobilization. You can either do stretches, you can do stretches so that it will move back to the place. And here is how chiropractic adjustment is very, very effective. And also there is something called as dawn therapy. You can all learn it. Just a second. I'll just add a video. I just Okay, I can't find the video now. I'll just, sorry about that. So, what we do is once we find out where there is, the connection, the loose connection, uh, we fix that area and then we treat it. Now, this is a very interesting concept, that we all have to understand. This is called the joint mobility and stability, right? So when you talk about your toes, they always have to be mobile, but your feet, right? The feet part has to be stable. Your ankle needs to be mobile because your ankle, like this is your ankle, sorry, this is your ankle joint, right? It needs to glide properly, otherwise it is, a problem. Your knee needs to be stable, right? Your hip needs to be mobile for easy movement. Your lower back has to be stable.